Hi, welcome to our channel of ignou audiobooks, Indira Gandhi National Open University, School of Social Sciences, SOSS, Master's Degree Programs, MA in Psychology, MAPC, Second Year, MPCE 0 to 3 Interventions in Counseling, Block-1 Psychological Interventions, Major Modalities, Unit-3 Interpersonal Counseling, 3.0 Introduction. An interpersonal relationship is an association between two or more people that may range from fleeting to enduring. A relationship is normally viewed as a connection between two individuals, such as a romantic or intimate relationship or a parent-child relationship. Individuals can also have relationships with groups of people, such as the relation between a family and relatives, or a mayor and a town. Finally, groups or even nations may have relations with each other, though this is a much broader domain than that covered under the topic of interpersonal relationships. These intimate relationships are, however, only a small subset of interpersonal relationships. Interpersonal relationships can also include friendships, such as relationships involving individuals providing relational care to marginalized persons. These relationships usually involve some level of interdependence. People in a relationship tend to influence each other, share their thoughts and feelings, and engage in activities together. Because of this interdependence, most things that change or impact one member of the relationship will have some level of impact on the other member. Exceptional interpersonal relationship skill is necessary for both personal and professional success. At the very least, relationship skills are for the purpose of making a connection with another human being. In the chapter, various aspects of interpersonal counseling and its importance for the counselor are covered. 3.1 Objectives. After going through this unit, you will be able to explain various concepts and importance of interpersonal counseling and interpersonal therapy, describe the nature of interpersonal perspective, define and state the meaning of interpersonal counseling, elucidate the goals of interpersonal counseling, IPC, describe the meaning of interpersonal therapy and its aim, identify problem areas, analyze the 4 basic interpersonal problem areas, elucidate the structure of interpersonal counseling, IPC, describe the subtypes of interpersonal therapy, IPT, and elucidate the various counseling techniques. 3.2 Nature of interpersonal perspective. Healthy relationships are built on a foundation of secure attachment and are maintained with love and purposeful positive relationship behaviors. Additionally, healthy relationships can be made to flourish. Positive psychologists are exploring what makes existing relationships flourish and what skills can be taught to people to enhance their existing and future personal relationships. Positive psychologists use the term flourishing relationships to describe interpersonal relationships that are not merely happy, but instead characterized by intimacy, growth, and resilience. Flourishing relationships also allow a dynamic balance between focus on the intimate relationships and focus on other social relationships. Humans are social beings, and much of what we are a product of our relationship with others. Psychological problems are increasingly coming to be viewed as primarily interpersonal in nature. However, it is only recently that all approaches have come to place the interpersonal in the forefront. Now, in psychodynamic area, object relation theory, attachment theory, and self-psychology hold that psychological problems are primarily a matter of disturbed relationship with other people, and therapy is primarily a matter of repairing such relationship. As cognitive therapist E.G. Aaron Beck C., personality disorder as dysfunctional interpersonal strategies that have been learned in an interpersonal matrix. In the humanistic view, Gestalt theory also emphasizes on interpersonal connections. Hence, it should not be surprising that many therapists concluded that abnormal behavior is best understood by analyzing our relationship, past and present, with other people. So, interpersonal factors refer to social chemistry or dynamic of relationship between the counselor and the clients. 3.3 Historical background. The roots of interpersonal approach lie in earlier developments in the psychodynamic movement. According to Adler, people, inherently social beings, are motivated primarily by the desire to belong to and participate in a group. Erikson also extended the interpersonal aspect of human being. Sullivan offered a comprehensive and systematic theory of personality that was explicitly interpersonal relation. Interpersonal accommodation is a process in which two people develop pattern of communication and interaction that enables them to attain common goals, meet mutual needs, and build a satisfying relationship. Interpersonal therapy was first developed as a theoretical placebo for the use in psychotherapy. Research by Gerald Klarman et al. IPT was, however, found to be quite effective in the treatment of several psychological problems. IPT was later developed in the 70s and 80s as a treatment for adults who were diagnosed with moderate or severe non-delusional clinical depressed and other psychological problems. IPT takes structure from psychodynamic psychotherapy, but also from contemporary cognitive behavioral approaches, also because it is time-limited. 3.4 Theories and empirical research. Researchers are developing an approach to couples therapy that moves partners from patterns of repeated conflict to patterns of more positive, comfortable exchanges. Goals of therapy include development of social and interpersonal skills, expressing gratitude and sharing appreciation for a partner is the primary means for creating a positive relationship. Positive marital counseling also emphasizes mindfulness. 3.4.1 Minding relationships. The mindfulness theory of relationships shows how closeness in relationships may be enhanced. Minding is the reciprocal knowing process involving the non-stop, interrelated thoughts, feelings, and behaviors of persons in a relationship. 5. Components of minding include knowing and being known, seeking to understand the partner, making relationship-enhancing attributions for behaviors, giving the benefit of the doubt, accepting and respecting, empathy and social skills, maintaining reciprocity, active participation in relationship enhancement, and continuity in minding, persisting in mindfulness. 3.4.2 Love. Love gives depth to human relationships. It brings people closer to each other and makes people think expansively about themselves and the world. Psychologist Robert Sternberg theorizes that love is a mix of three components: 1. Passion or physical attraction, 2. Intimacy or feelings of closeness, and 3. Commitment, involving the decision to initiate and sustain a relationship. The presence of all three components characterizes consummate love, the most durable type of love. In addition, the presence of intimacy and passion in marital relationships predicts marital satisfaction. Also, commitment is the best predictor of relationship satisfaction, especially in long-term relationships. Positive consequences of being in love include increased self-esteem and self-efficacy. 3.4.3 Neurobiology of interpersonal connections. There is an emerging body of research across multiple disciplines investigating the neurological basis of attachment and the pro-social emotions and behaviors that are the prerequisites for healthy adult relationships. The social environment mediated by attachment influences the maturation of structures in a child's brain. This might explain how infant attachment affects adult emotional health. 3.5 Interpersonal counseling, IPC. Interpersonal counseling derives directly from IPT but is briefer in the number and duration of sessions. It is designed for patients who are in distress and have symptoms due to current stressors in their lives, but who do not have serious concurrent psychiatric disorders or medical conditions that can or should be treated more effectively by medication or other psychosocial treatments. Interpersonal counseling, IPC, is a derivative form of interpersonal therapy, IPT. IPT is a brief technique that has antecedents in the work of Harry Stack Sullivan, but has been modified into its own form of therapy since the 1980s. It consists of roughly 12 to 16 sessions, 50 to 60 minutes per sessions, and has been suggested for treatment of conditions like depression, personality disorder, etc. The interpersonal counseling (IPC) method is a shortened form of interpersonal therapy (IPT) that usually consists of 6 sessions and is not more than half an hour. Within the interpersonal counseling IPC framework, psychological distress is viewed as having 3 component processes: I. Symptom formation, somatic signs and symptoms, e.g. fatigue, sleep disturbance, headaches; 2. Social and interpersonal relations; and 3. Personality enduring traits and behaviors which may contribute to a predisposition to symptom episodes. 3.5.1 Goals of Interpersonal Counseling. The goals of interpersonal counseling, IPC, are to intervene to reduce psychological symptoms, restoring morale and improving self-esteem, improve the quality of the patient's social adjustment and interpersonal relations. 3.6 Interpersonal therapy. Interpersonal psychotherapy. Interpersonal therapy is a time-limit counseling that focuses on the interpersonal context and on building interpersonal skills. Where interpersonal psychotherapy, IPT, is based on the belief that interpersonal factors may contribute heavily to psychological problems. It is commonly distinguished from other forms of therapy in its emphasis on interpersonal processes rather than intrapsychic processes.
In interpersonal counseling and therapy, therapists work with clients over issues like depression and other disorders in context of the way symptoms have formed and the way they affect social functioning. At the same time, both IPT and IPC evaluate how social functioning is affected by things like arguments, transitions in roles, experience of grief, or by few or poor interpersonal relationships. Interpersonal therapy focuses on the present. It can also improve the client's future through increased awareness of preventive measures and strengthened coping skills. Interpersonal psychotherapy typically proceeds in several stages. In the initial stages, therapeutic goals typically include diagnosis, completing the requisite inventories, identifying the patient's major problem areas, and creating a treatment contract. Interpersonal counseling and therapy is a short-term supportive psychotherapy that focuses on the connection between interactions between people and the development of a person's psychiatric symptoms. 3.6.1 Goals of Interpersonal Psychotherapy, IPT. IPT aims to change the person's interpersonal behavior by fostering adaptation to current interpersonal roles and situations. IPT emphasizes the ways in which a person's current relationships and social context cause or maintain symptoms rather than exploring the deep-seated sources of the symptoms. Its goals are rapid symptom reduction and improved social adjustment. A frequent byproduct of IPT treatment is more satisfying relationships in the present. Interpersonal therapy was initially developed to treat adult depression. It has since been applied to the treatment of depression in adolescents, the elderly, and people with human immunodeficiency virus (HIV) infection. There is an IPT conjoint couple therapy for people whose marital disputes contribute to depressive episodes. IPT has also been modified for the treatment of a number of disorders, including substance abuse, bulimia, depressed pregnant women, and people suffering from protracted bereavement. 3.7 Identification of problem areas. Although originally developed as an individual therapy for adults, IPT, interpersonal therapy, has been modified for use with adolescents and older adults. Interpersonal therapy, IPT, has been adapted for the treatment of depressed adolescents as developmental issues are most common to teenagers, such as separation from parents, development of romantic relationships, and initial experience with death of a relative or friend etc. Interpersonal therapy for adolescent help the adolescent identify and develop more adaptive methods for dealing with the interpersonal issues associated with the onset or maintenance of their depression. It is typically a 12 to 16 week treatment. Although the treatment involves primarily individual sessions with the teenager, parents are asked to participate in a few sessions to receive education about problem, to address any relationship difficulties that may be occurring between the adolescent and his/her parents, and to help support the adolescent's treatment. The techniques of interpersonal therapy (IPT) were developed to manage four basic interpersonal problem areas: unresolved grief, role transitions, interpersonal role disputes, often marital disputes, and interpersonal deficiencies. In the early sessions, the interpersonal therapist, counselor, and the client attempt to determine which of these four problems is most closely associated with the onset of the current depressive episode. Therapy is then organized to help the client deal with the interpersonal difficulties in the primary problem area. The coping strategies that the client is encouraged to discover and employ in daily life are tailored to his or her individual situation. 3.7.1 Unresolved grief. In normal bereavement, person experiences symptoms such as sadness, disturbed sleep, and difficulty functioning, but these usually resolve in 2 to 4 months. Unresolved grief in depressed people is usually either delayed grief, which has been postponed and then experienced long after the loss, or distorted grief, in which there is no felt emotion of sadness but there may be non-emotional symptoms, often physical. If unresolved grief is identified as the primary issue, the goals of treatment are to facilitate the mourning process. Successful therapy, counseling will help the client re-establish interests and relationships that can begin to fill the void of what has been lost. 3.7.2 Role disputes. Interpersonal role disputes occur when the client and at least one other significant person have differing expectations of their relationship. The IPT therapist, counselor focuses on these disputes if they seem stalled or repetitious, or offer little hope of improvement.
The treatment goals include helping the client identify the nature of the dispute, decide on a plan of action, and begin to modify unsatisfying patterns, reassess expectations of the relationship, or both. The therapist-counselor does not direct the client to one particular resolution of difficulties and should not attempt to preserve unworkable relationships. 3.7.3 Role transitions. Depression associated with role transitions occurs when a person has difficulty coping with life changes that require new roles. These may be such transitions as retirement, a career change, moving, or leaving home. People who are clinically depressed are most likely to experience role changes as losses rather than opportunities. The loss may be obvious, as when a marriage ends, or more subtle, as the loss of freedom people experience after the birth of a child. Therapy counseling is terminated when a client has given up the old role, expressed the accompanying feelings of guilt, anger, and loss, acquired new skills, and developed a new social network around the new role. 3.7.4 Interpersonal deficits. Interpersonal deficits are the focus of treatment when the client has a history of inadequate or unsupportive interpersonal relationships. The client may never have established lasting or intimate relationships as an adult and may experience a sense of inadequacy, lack of self-assertion, and guilt about expressing anger. Generally, clients with a history of extreme social isolation come to therapy with more severe emotional disturbances. The goal of treatment is to reduce the client's social isolation instead of focusing on current relationships. Therapy counseling in this area focuses on the client's past relationships, the present relationship with the therapist-counselor, and ways to form new relationships. 3.8 Structure Model of Interpersonal Counseling, IPC. One of the most influential models of relationship development was proposed by psychologist George Levinger. This model was formulated to describe heterosexual, adult romantic relationships, but it has been applied to other kinds of interpersonal relations as well. According to the model, the natural development of a relationship follows 5 stages. 1. Acquaintance. Becoming acquainted depends on previous relationships, physical proximity, first impressions, and a variety of other factors. If two people begin to like each other, continued interactions may lead to the next stage, but acquaintance can continue indefinitely. 2. Build up. During this stage, people begin to trust and care about each other, the need for intimacy, compatibility and such filtering agents as common background and goals will influence whether or not interaction continues. 3. Continuation. This stage follows a mutual way of commitment to a long-term friendship, romantic relationship, or marriage. It is generally a long, relative, stable period. Nevertheless, continued growth and development will occur during this time. Mutual trust is important for sustaining the relationship. 4. Deterioration. Not all relationships deteriorate, but those that do tend to show signs of trouble. Boredom, resentment, and dissatisfaction may occur, and individuals may communicate less and avoid self-disclosure. Loss of trust and betrayals may take place as the downward spiral continues, eventually ending the relationship. Alternately, the participants may find some way to resolve the problems and re-establish trust. 5. Termination. The final stage marks the end of the relationship, either by death in the case of a healthy relationship or by separation. 3.8.1 Factors affecting interpersonal counseling. The structure of interpersonal counseling is based on the various factors of the client personality, and the focus is on following: client's emotions, an exploration of client's resistance to treatment, discussion of patterns in client's relationships and experiences, taking a detailed past history, an emphasis on client's current interpersonal experiences. Exploration of the counselor-client relationship, identification of client's wishes and fantasies. These are the 7 types of factors interventions that are commonly used in interpersonal counseling, many of which reflect the influence of psychodynamic psychotherapy. 3.8.2 Important features for interpersonal counseling. For counselor, to begin with interpersonal counseling, following point should be in mind by the counselor: establish rapport, rule out physical illness as a cause for symptoms, determine the presence of any specific psychiatric diagnosis, introduce IPC and suggest the possible relationship between the patient's symptoms of distress and current life stress, explore the patient's current interpersonal and social situation. Interpersonal diagnosis. Identify with the patient the specific current stress areas that are contributing to the symptoms. Interpersonal formulation. Help the patient deal more positively with the specific stress area identified. Homework assignments are used to accelerate the process of change for each area. Termination of the IPC relationship. 3.8.3 Stages of interpersonal counseling. IPC. The structure of IPC is of a brief treatment of 6 sessions, each with an explicit focus, assessment, education about the interaction between interpersonal relationships and psychological symptoms, identifying current stress areas and helping the patient deal with these more positively, and termination of the IPC relationship. Interpersonal counseling can be utilized general practice to reduce psychological symptoms, restore morale, and improve self-esteem and the quality of the client's social adjustment and interpersonal relationships. For e.g. Visit 1, the treatment contract. In the first visit, usually the longest session, the counselor determines the client's suitability for IPC. People with major depression, bipolar disorder, or who are psychotic or suicidal are not suitable for IPC as the therapy is provided. In order to establish an interpersonal diagnosis, the counselor asks the client about recent changes in life circumstances, mood and social functioning, and explores how life circumstances relate to the onset of symptoms. By the end of the session, the counselor should develop an explicit treatment contract with the client that emphasizes the no psychiatric motive of the intervention, i.e. the focus is on understanding how life stresses are contributing to feelings of the clients, the short-term duration of the intervention, up to 6 sessions of up to 30 minutes each, the expected benefits, to reduce symptoms to find better ways of coping, and that IPC is in addition to usual medical care. At the end of the visit, the counselor gives the client homework on life events and asks him/her to bring in back to the next visit, visit 2. Determining the specific problem areas. The counselor must determine the specific problem areas which is useful to review. The following: onset and duration of present symptoms, current life circumstances, close interpersonal relationships, and any recent changes in any of these. Overall, the counselor's task is to assist the client to identify the key persons with whom he/she is having difficulties, what type of problems are being experienced, and whether there are ways to make the relationship more satisfactory. Visits 3 to 5. Working on specific stress areas. The counselor works with the client to deal with specific problem areas. Example: grief or loss, help the patient re-establish interests and significant other relationships that can substitute for what is lost. Talk of the deceased, the type of person he/she was, relationship with them, circumstances of illness and death, look over old photographs, see old friends and discuss at subsequent sessions, encourage involvement in new social activities. Enable the client to regard the new role in a more changes positive, less restricted manner, or see as and similar to those for grief. Giving up old role, facilitate opportunity for growth. Evaluation of what has been lost, encourage release of, restore self-esteem by developing in the client an affect and develop social support system. Visit 6. Termination. This visit is usually held 2 weeks after visit 5, but may be earlier if the client feels they have achieved all they wanted. The counselor should review the previous sessions and the client's current state and discuss the termination of IPC. The counselor should emphasize the progress made, the supports available to the client, and ability to cope with future problems. The counselor should work with the patient to identify potential sources of stress and ways in which the client could cope with these, especially referring to strategies that the counselor found effective during counseling. Many clients will show concern about termination. In some cases, an additional visit can also be arranged to complete the termination process. In the end stages of IPT, the therapist works to consolidate the client's gains. Discuss areas which still require work, talk about relapse prevention, and process any emotions related to termination of therapy. 3.9 Counseling techniques. Interpersonal counseling is a part of psychodynamic therapy, and so it is derived from psychoanalytic theory of Freud, with its emphasis on the unconscious and childhood experiences. Symptoms and personal difficulties are regarded as arising from deep, unresolved personality or character problems. Psychoanalytic counseling is time-consuming and is a long-term method of treatment, and the results are also very slow. Therefore, now it is not in much use. 3.9.1 Practical applications. Interpersonal counseling is designed to help the patient master the context and uses the connection between the onset of depressive symptoms and current interpersonal problems as a practical and common-sense treatment focus.
Therapy is focused rather than non-directive and deals with current, not past, interpersonal relationships. The focus is interpersonal rather than intra-psychic or cognitive, behavioral. Essentially, the counselor needs to consider 3 questions. 1. Are the client's problems amenable to and best treated by a psychological therapy? 2. Is this client likely to benefit from, ready for, and motivated to use a psychological therapy? And 3. Is IPC the most suitable psychological approach? A client's motivation and expectations are critical factors for a successful outcome with psychological treatments. Motivation is a dynamic variable that may vary with treatment successes or disappointments. Appropriate realistic expectations of the treatment and the client's ability to be introspective, self-reflective and reality-oriented will also influence the likelihood of success. The IPC approach depends on the principle that life events and the social environment affect mood, and that mood can affect social and interpersonal functioning and one's response to the environment. Treatment with IPT is based on the premise that depression occurs in a social and interpersonal context that must be understood for improvement to occur. In the first session, the psychiatric history includes a review of the client's current social functioning and current close relationships, their patterns and their mutual expectations. Changes in relationships prior to the onset of symptoms are clarified, such as the death of a loved one, a child leaving home, or worsening marital conflict. Treatment with IPC, however, is sometimes combined with drug therapy, particularly when the client suffers from such mood disorders as depression, dysthymia, or bipolar disorder. Since the interpersonal therapy model was developed for the treatment of depression and then modified for use with other populations and mental disorders, an understanding of IPT's approach to depression is crucial. Interpersonal therapists focus on the functional role of depression rather than on its etiology or cause, and they look at the ways in which problematic interactions develop when a person becomes depressed. The IPT framework considers clinical depression as having three components: the development of symptoms, which arise from biological, genetic and/or psychodynamic processes; social interactions with other people, which are learned over the course of one's life; and personality, made up of the more enduring traits and behaviors that may predispose a person to depressive symptoms. IPT intervenes at the levels of symptom formation and social functioning, and does not attempt to alter aspects of the client's personality. IPT is psychoeducational in nature to some degree. It involves teaching the client about the nature of depression and the ways that it manifests in his or her life and relationships. In the initial sessions, depressive symptoms are reviewed in detail, and the accurate naming of the problem is essential. The therapist then explains depression and its treatment and may explain to the client that he or she has adopted the sick role. The concept of the sick role is derived from the work of a sociologist named Talcott Parsons, and is based on the notion that illness is not merely a condition but a social role that affects the attitudes and behaviors of the client and those around him or her. Over time, the client comes to see that the sick role has increasingly come to govern his or her social interactions. 3.9.2 Behavioral Therapy. Behavioral therapy is used to counsel people with depression by focusing on the external behavior rather than the internal cognitive processes that stimulate the behavior. The key to this method of counseling lies in the fact that the person is depressed because of one's behavior, and that changing behavior will control the feelings associated with depression. Behavioral changes can produce quite significant results in some people, but it still leaves the underlying issues and causes of depression unexplored. 3.9.3 Cognitive Therapy. Cognitive therapy is the opposite of the behavioral technique. This form of counseling seeks to find the solution in patients' thought processes. Cognitive counseling seeks to change negative thoughts such as pessimism, hopelessness, self-criticism, and unrealistic outlooks and expectations. The key to successful cognitive therapy is learning to distinguish between the really important issues affecting one's life and the minor or even trivial issues. 3.9.4 Interpersonal Therapy. Interpersonal therapy is a form of counseling that attempts to locate how social interaction affects depression. Interpersonal therapy does not try to place social contexts as a root cause of depression, but understands that the way that people react to others has a profound effect on the development of symptoms.
This form of counseling extends beyond actual interpersonal behavior to take into consideration such things as fantasies, fears, anxieties, and wishes as they relate to social interaction. 3.9.5 Psychotherapy. Psychotherapy is the form of counseling that is most often associated with treating mental illness. It is the counseling that brings to mind the Freudian psychologist listening to a patient lying on a couch. In reality, the therapist may not subscribe to Freudian theory at all. The purpose of psychotherapy is to get to the core of the causes of depression. As a result, every aspect of the patient's life is fair game. The patient who chooses this form of counseling needs to be very comfortable with and confident in the therapist and be unafraid to open up and discuss even the most painful and personal aspects of one's life. 3.9.6 Psychodynamic Counseling. Psychodynamic counseling is the type of therapy associated with Freudian techniques. This form of counseling differs from psychotherapy by placing the entire emphasis on the unconscious and subconscious thought processes. Rather than attempting to locate alternative causes, Psychodynamic counseling seeks specifically to uncover unresolved conflicts that developed during childhood. The aim is to resolve these conflicts. If resolution is impossible, then the patient learns how to cope better with the conflicts. 3.10 Applications 3.10.1 IPT-IPC in special populations. 1. Elderly clients. In translating the IPT model of depression to work with different populations, the core principles and problem areas remain essentially the same, with some modifications. In working with the elderly, IPT sessions may be shorter to allow for decreased energy levels, and dependency issues may be more prominent. In addition, the therapist may work with an elderly client toward tolerating rather than eliminating long-standing role disputes. 2. Clients with HIV infection. In IPT with HIV-positive clients, particular attention is paid to the client's unique set of psychosocial stressors, the stigma of the disease, the effects of being gay, if applicable. Dealing with family members who may isolate themselves, and coping with the medical consequences of the disease. 3. Adolescents. In IPT with adolescents, the therapist addresses such common developmental issues as separation from parents, the client's authority in relationship to parents, the development of new interpersonal relationships, first experiences of the death of a relative or friend, peer pressure, and single-parent families. Adolescents are seen weekly for 12 weeks with once-weekly additional phone contact between therapist and client for the first 4 weeks of treatment. The parents are interviewed in the initial session to get a comprehensive history of the adolescent's symptoms and to educate the parents as well as the young person about depression and possible treatments, including a discussion of the need for medication. The therapist refrains from giving advice when working with adolescents and will primarily use supportive listening while assessing the client for evidence of suicidal thoughts or problems with school attendance. So far, research does not support the efficacy of antidepressant medication in treating adolescents, though most clinicians will give some younger clients a trial of medication if it appears to offer relief. 4. Interpersonal therapy for adolescents. IPT for kids is based on the premise that depression occurs in the context of an individual's relationships regardless of its origins in biology or genetics. More specifically, depression affects people's relationships, and these relationships further affect our mood. The IPT model identifies 4 general areas in which a person may be having relationship difficulties. 1. Grief after the loss of a loved one. 2. Conflict in significant relationships. 3. Difficulties adapting to changes in relationships or life circumstances. And 4. Difficulties stemming from social isolation. The IPT therapist helps identify areas in need of skill building to improve the client's relationships and decrease the depressive symptoms. Over time, the client learns to link changes in mood to events occurring in his/her relationships. Communicate feelings and expectations for the relationships and problem-solve solutions to difficulties in the relationships. 5. Clients with substance abuse disorders. While IPT has not yet demonstrated its efficacy in the field of substance abuse recovery, a version of IPT has been developed for use with substance abusers. The 2 goals are to help the client stop or cut down on drug use and to help the client develop better strategies for dealing with the social and interpersonal consequences of drug use. To meet these goals, the client must accept the need to stop, take steps to manage impulsiveness, and recognize the social contexts of drug purchase and use. Relapse is viewed as the rule rather than the exception in treating substance abuse disorders, and the therapist avoids treating the client in a punitive or disapproving manner when it occurs. Instead, The therapist reminds the client of the fact that staying away from drugs is the client's decision. 6. Clients with eating disorders. IPT has been extended to the treatment of eating disorders. The IPT therapist does not focus directly on the symptoms of the disorder, but rather allows for identification of problem areas that have contributed to the emergence of the disorder over time. IPT appears to be useful in treating clients with bulimia whose symptoms are maintained by interpersonal issues, including social anxiety, sensitivity to conflict and rejection, and difficulty managing negative emotions. IPT is helpful in bringing the problems underlying the binging and purging to the surface, such as conflict avoidance, difficulties with role expectations, confusion regarding needs for closeness and distance, and deficiencies in solving social problems. IPT also helps people with bulimia to regulate the emotional states that maintain the bulimic behavior. Anorexia nervosa also appears to be responsive to treatment with IPT. Research indicates that there is a connection between interpersonal and family dysfunction and the development of anorexia nervosa. Therapists disagree as to whether interpersonal dysfunction causes or is caused by anorexia. IPT has been helpful because it is not concerned with the origin but rather seeks to improve the client's interpersonal functioning and thereby decreasing symptoms. IPT's 4 categories of grief, interpersonal disputes, interpersonal deficits, and role transitions correspond to the core issues of clients with anorexia. Social phobia is another disorder that responds well to IPT therapy. 3.11 Subtypes of interpersonal therapy. IPT interpersonal therapy offers two possible treatment plans for persons with depressive disorders. The first plan treats the acute episode of depression by eliminating the current depressive symptoms. This approach requires intervening while the person is in the midst of a depression. The acute phase of treatment typically lasts 2 to 4 months with weekly sessions. Many clients terminate treatment at that point after their symptoms have subsided. Maintenance treatment, IPTM, is the second treatment plan and is much less commonly utilized than acute treatment. IPTM is a longer-term therapy based on the principles of interpersonal therapy but with the aim of preventing or reducing the frequency of further depressive episodes. Some clients choose IPTM after the acute treatment phase. IPTM can extend over a period of 2 to 3 years, with therapy sessions once a month. 3.12 Interpersonal therapy as a maintenance approach. IPTM. Interpersonal therapy as a maintenance approach, IPTM, could be viewed as aftercare for clients suffering from depression. It is designed as a preventive measure by focusing on the period after the acute depression has passed. Typically, once the client is in remission and is symptom-free, he or she takes on more responsibilities and has increased social contact. These changes can lead to increased stress and greater vulnerability to another episode of depression. IPTM enables clients to reduce the stresses associated with remission and thereby lower the risk of recurrence. The goal of maintenance therapy is to keep the client at his or her current level of functioning. Research has shown that for clients with a history of recurrent depression, total prevention is unlikely, but that maintenance therapy may delay a recurrence. In general, long-term maintenance psychotherapy by itself is not recommended unless there are such reasons as pregnancy or severe side effects that prevent the client from being treated with medication. IPTM does, however, seem to be particularly helpful with certain groups of patients, either alone or in combination with medication. Women appear to benefit due to the importance of social environment and social relations in female gender roles, the effects of the menstrual cycle on symptoms and complications related to victimization by rape, incest, or battering. IPT is also useful for elderly clients who can't take antidepressants due to intolerable side effects or such medical conditions as autoimmune disorders, cardiovascular disorders, diabetes, or other general medical conditions. 3.13 Interpersonal relationship skill. Like living organisms, relationships have a beginning, a lifespan, and an end. They tend to grow and improve gradually as people get to know each other and become closer emotionally, or they gradually deteriorate as people drift apart, move on with their lives and form new relationships with others. Healthy interpersonal skills reduce stress, reduce conflict, improve communication, enhance intimacy, increase understanding, and promote joy.
Interpersonal skills are all the behaviors and feelings that exist within all of us that influence our interactions with others. The following are the important skills for the counselors by which the clients can be helped. 1. Communication skills. Communion demands that we listen as well as speak. 2. Assertiveness skills. Expressing ourselves and our rights without violating the rights of others. 3. Conflict resolution. Conflict is natural and inevitable. Conflict resolution helps us to resolve differences so that we may continue with the relationship in an effective way. 4. Anger management. Knowing how to recognize and express anger appropriately can help us to reach goals, handle emergencies, solve problems, and even protect our health. Because relationship success requires good relationship skills, so counselor can make the client learn to make stronger interpersonal connections by fill circle. Understand the purpose or motive of our communication, give information, connect with others, resolve conflict. Fill circle. Speak graciously, without using offensive words. Fill circle. Give the benefit of the doubt, doesn't blame others. Fill circle. Help the clients by giving the facts, i.e., people can listen about 4 times faster than they speak. The average listening comprehension speed is about 600 words per minute. The average speaking speed is 150 to 200 words per minute. What does this bit of truth mean to our interpersonal relationship skills? More focused energy is required to be a good listener. Listen more than you speak. After all, God gave us 2 ears and 1 mouth. Remember the 80-20 rule. When someone is speaking to you, you should listen 80% of the time and speak only 20%. Teach them to be an excellent listener by fill circle. Caring more about what the speaker is saying than your response. Fill circle. Choosing not to argue in your head with the listener. Fill circle. Choosing not to formulate your rebuttal while the speaker is talking. Fill circle. Instead, tune in completely to what they are saying for the purpose of understanding them. Fill circle. Choosing to respond to what they said, rather than what you want to say. You were made for relationship, therefore, choose to be more committed to making a healthy connection with others by developing your interpersonal relationship skill. Our personal and professional success depends on it. 3.14 Summary. Interpersonal counseling is a practical and effective approach for the treatment of common mental health problems that can readily be integrated into general practice. The focus on life events, social, and interpersonal problems is familiar to counselors. The expected outcomes of interpersonal therapy are a reduction or the elimination of symptoms and improved interpersonal functioning. There will also be a greater understanding of the presenting symptoms and ways to prevent their recurrence. E.g., in the case of depression, a person will have been educated about the nature of depression, what it looks like for him or her, and the interpersonal triggers of a depressive episode. A person will also leave therapy with strategies for minimizing triggers and for resolving future depressive episodes more effectively. Some researchers criticize positive psychology for studying positive processes in isolation from negative processes. On the contrary, some argue that positive and negative processes in relationships may be better understood as functionally independent, not as opposites of each other. Thank you. Subscribe to our channel for more updates, and we will see you with the next chapter.